Schizophrenia is a term we often hear, but what does it really mean? Schizophrenia is a chronic and severe mental disorder that impacts a person's thinking, feelings, and behavior. It's characterized by disturbances in multiple aspects of mental functioning. The way one perceives reality, the emotions one feels, and one's behavior. Schizophrenia affects it all. The person suffering from this disorder might see or hear things that aren't there, known as hallucinations, or hold beliefs that are not based in reality, known as delusions. Schizophrenia also involves disorganized thinking and speech. Imagine having your thoughts tumble around in your mind, making it hard to follow a conversation or express your thoughts clearly. It's important to understand that schizophrenia is not a split personality or multiple personality disorder. It's a disorder that disrupts the normal functioning of the human mind, making it hard for the person to distinguish between what is real and what isn't. Schizophrenia is a combination of numerous symptoms that affect a person's mental state. Understanding schizophrenia begins with identifying its symptoms. These are divided into positive and negative symptoms. Positive symptoms are manifestations of experiences not typically present in the general population. Examples of these are hallucinations, often auditory in nature, where individuals hear voices others cannot. Delusions are another positive symptom. These are false beliefs held by a person despite clear evidence to the contrary. Disorganized thinking and speech are also prevalent. This symptom can make conversations challenging, as thoughts might seem to jump from one topic to another with no clear connection. Lastly, positive symptoms include grossly disorganized or abnormal motor behavior, which can manifest in many ways, from childlike silliness to unpredictable agitation. Contrary to positive symptoms, negative symptoms are about the absence of normal behaviors. Reduced emotional expression is one such symptom, where individuals with schizophrenia may not exhibit the emotions expected in certain situations. Lack of motivation or avolition is another negative symptom, where simple tasks like cleaning or personal grooming can become monumental challenges. Social withdrawal is also common, and individuals often prefer to spend time alone, avoiding social interactions. Lastly, we have diminished speech or alogia, where individuals may speak less, even when prompted to engage in conversation. Identifying these symptoms early can lead to faster diagnosis and treatment. Remember, schizophrenia affects everyone differently, and not everyone will experience every symptom. Moreover, the severity and frequency of symptoms can vary greatly. Understanding these symptoms, we can contribute to a more empathetic and informed society. What causes schizophrenia? The answer is a combination of genetic, neurochemical, structural, and environmental factors. Schizophrenia tends to run in families, which points to a genetic link. If a close family member has the disorder, there is a higher risk of developing it. But family history is not the only factor. Neurochemical imbalances, specifically in neurotransmitters such as dopamine, serotonin, and glutamate, are implicated in schizophrenia. The structure and function of the brain are also significant. Individuals with schizophrenia often have abnormal brain structures, including enlarged ventricles and reduced gray matter volume. Environmental factors also contribute to the risk. These factors can include exposure to toxins or infections during pregnancy, maternal stress, or birth complications. However, having these risk factors doesn't guarantee development of schizophrenia. More research is needed to fully understand this disorder. Even though the exact cause is unknown, these factors increase the risk of developing schizophrenia. Diagnosing schizophrenia involves a comprehensive. It's not simply a single test or quick consultation. It's a series of detailed assessments, a careful examination of symptoms, medical history, and family history, in a thorough psychiatric evaluation. Health professionals use a guidebook, the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5. This manual provides specific criteria for diagnosing schizophrenia, such as experiencing at least 2 of the following symptoms for a significant portion of time during a 1-month period: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms. One of these symptoms must be either delusions, hallucinations, or disorganized speech. These disturbances must cause significant social or occupational dysfunction. Many symptoms of schizophrenia can overlap with other mental disorders or be caused by certain medical conditions or substance use. Therefore, other potential causes must be ruled out. This could involve medical tests, psychiatric evaluations of other disorders, or assessments for substance use. A diagnosis of schizophrenia is not an end, but a beginning to a path towards management and treatment. A correct diagnosis allows for a tailored treatment plan, opening the door to better understanding and control of this complex condition. Schizophrenia treatment is multifaceted, primarily managed with antipsychotic medications. They play a vital role in alleviating hallmark symptoms like hallucinations and delusions by normalizing neurotransmitter imbalances in the brain. These medications, however, may be less effective for negative symptoms, such as reduced emotional expression or lack of motivation. Psychosocial interventions are a key component of treatment. They include cognitive behavioral therapy, supportive therapy, and family therapy. Cognitive behavioral therapy helps individuals challenge and change distorted perceptions and thoughts, while supportive therapy improves self-esteem and coping skills. Family therapy equips families with tools to better understand and support their loved one. In severe cases during acute psychotic episodes, hospitalization may be necessary for the individual's safety and to provide a setting for intensive treatment. Treatment strategies are not one-size-fits-all. They are tailored to meet each individual's specific needs, symptoms, and circumstances. For instance, a person with severe hallucinations might require a different medication or dosage compared to someone experiencing more pronounced negative symptoms. The treatment journey may involve trial and error, requiring patience, resilience, and a good support system. Treatment is not one-size-fits-all, but tailored to each individual's needs. Living with schizophrenia is a lifelong journey requiring ongoing management and support. The course of schizophrenia varies widely among individuals, but it's not a definitive determinant of one's life. Appropriate treatment and support enable many individuals with schizophrenia to lead fulfilling lives, achieving significant improvements in symptoms and functioning. Management involves medication, therapy, and lifestyle modifications. Adherence to prescribed medication is crucial, managing symptoms and preventing relapse. Therapy, including cognitive behavioral therapy, helps individuals cope with symptoms and improve social interactions. Regular exercise, a balanced diet, and adequate sleep contribute to better overall health and well-being. Close monitoring of symptoms, regular checkups, and access to support services optimize outcomes. Schizophrenia is not a life sentence. With the right support and treatment, symptoms can be managed and meaningful lives led.